Welcome to Medically Speaking. My guest today is Dr. Dori Marshall, the Chief Medical Officer at Oishei Children's Hospital. Doc, thanks for joining us today.
Thank you for having me, Mike.
I know we want to talk a little bit about the behavioral health program at the hospital, and we'll get into that in a second. But if we can, let's start with you. Give us a little bit of your background and how you ended up in your role today at the hospital. And as CMO, what does your daily responsibilities look like?
So I'm a physician. I graduated here in Buffalo from UB's Jacobs School of Medicine, and I completed my residency in psychiatry. In my last year of residency, I spent a few months working on the adolescent unit at ECMC, and I fell in love with it. And I spent the next 11 years focused on working with children and families in crisis. I moved into a more administrative clinical role in 2017 when I became the Associate Dean and Director of Admissions for the UB School of Medicine. And then I transitioned last August into my current role, which is the Chief Medical Officer at Oishei Children's Hospital. In this role, I have the opportunity to support all the physicians who provide care to all the patients who Oishei serves, the women, the babies, the children, the teenagers. We're the only freestanding children's hospital in New York State and the only hospital in Western New York that provides level 1 trauma care to children and also serves as the regional perinatal center for women and newborns. And you see that in the outpouring of support the community provides during our annual Giving Day and the annual 117 Holes for Children's golf tournament. Together, both events raising over $1 million to support the women and children cared for at Oishei Hospital.
Yeah, just a community treasure, and so great to see everyone in Western New York supporting the hospital these days. So your background obviously seemingly has prepared you for not only the position that you're in, but some of the issues that we're facing as a community, in particular behavioral health. For the viewers who are watching this, let's start with the definition of behavioral health, because I know sometimes people get it mixed up with some other clinical definitions, but for behavioral health, what does that term mean and why is that so important?
It's a good question. When we talk about behavioral health, we're really talking about a broad field that spans mental illness, mental health, substance use, behavioral patterns that are more or less adaptive, developmental disabilities can be included, as well as interpersonal relationships. And probably more than that, that's what I'm coming up with. It deals with everything from mild depression and anxiety to incapacitating mood disorders, anxiety disorders, psychotic disorders, substance use, anger management issues, developmental challenges, autism spectrum disorders, and identity challenges. Again, there's probably even more than that, but I think that's a good representation. It's an area within healthcare which, like many areas of healthcare, receives input from lots of different types of providers. I'm a psychiatrist, and we tend to provide input when medication is indicated, but not always. We also have psychologists, mental health counselors, social workers, nurses, psychiatric nurse practitioners, physician assistants, even primary care doctors, including pediatricians. All these professionals help provide care in the behavioral health sphere. And that sphere can include outpatient care or inpatient care or day treatment programs, which provide a little bit more structure than outpatient. So, outpatient care is often, one visit a month or one visit every 2 months, maybe 2 visits a month, but not much more than that. Whereas, a day treatment program or an intensive program might provide care for 1, 2, or 3 days a week from 9 to 3. And so just providing more structure than needing to be hospitalized, which is the highest level of care.
Why now? Why is this such a focus for children's? Why has this issue, in particular behavioral health, I know encompasses an awful lot of topics. Why has this become such a topic or such a focus today?
They were focused on developing child psychiatry at Oishei since the 1980s, if not the 1970s. But I believe that the scope has broadened over the decades to include more than we used to consider when talking about child psychiatry and mental health. And of course, since the pandemic, we've been faced as a nation with significant increases in persistent feelings of sadness and hopelessness among our young people. If you look at the CDC, they're reporting that 57% of girls and 29% of boys and 69% of kids who identify as LGBTQ, are having persistent, intense feelings of sadness and hopelessness. And that is reflected in increases in suicide rates. Suicide is now the second leading cause of death among children between the ages of 10 and 14. So, I think as a community, whether you look at that community at the local level or the state level or the national level, our communities are really in crisis when it comes to our children and mental health.
And those are some staggering statistics, but obviously we're here to talk about what Children's is doing, what they can do for families or kids that are struggling. So if you can, talk a little bit about some of the things that the hospital is working on.
I appreciate that because Oishei is doing a lot and wants to continue to do even more. Starting with our outpatient clinic, we have a very robust outpatient clinic. It has over 11,000 visits per year. So seeing children and their families, all year long. We have a number of different groups that clinic offers. We have a dialectic behavior therapy group, which provides individual therapy and family therapy for children who are struggling with intense emotional, reactivity, self-harm behavior, that kind of thing. We have an ADHD group that works with families and individuals, providing family therapy to children with ADHD. Have recently, in the last year, started an eating disorder intensive outpatient program for the children between the ages of 8 and 13. It was really a need in our community that was lacking. And this is a program that lasts between 10 to 12 weeks. Dr. Kristen Sircone is the director of that program, and they're doing really amazing work for the children of our community. We also have an OCD, obsessive compulsive disorder intensive program. The length of that program is 6 to 8 weeks. We've had wonderful successes. Dr. Alex Cogswell is a psychologist who runs that program. Then when we look at what Oishei is doing within the hospital itself, we have a clinic that's we call it the Healthy Way of Buffalo. And this is a comprehensive and multidisciplinary program for children and adolescents, providing personalized attention to weight loss and health goals. And then we have on the inpatient side of Oishei, we have a psychiatry team that will see children who are hospitalized either primarily because they are struggling with a psychiatric or mental health issue, or they are receiving treatment for another need, and concomitantly struggling with mood disorders or anxiety disorders, or even just how to manage, the treatment that they need, and how to react to that and respond to that. So we have a team of psychiatrists and psychologists who will go to patients who are here in the hospital and work with them and their families to help them while they're here in the hospital. So I think we have really increased the services that we provide to the broad community and to the community within the hospital in the last few years.
Yeah, I mean, a plethora of resources and programs that you just listed off. As we wrap up here, what is your advice? I mean, you talked about, post-pandemic, there's the impact of social media on some of these young kids. For the parents who may be struggling with their kids at home, they don't know how to address it, or they're afraid to address it because of the stigma attached to it. How does someone get started in terms of their journey and be dealing with someone who may have a behavioral health challenge?
It's a great question. And I think that, it can be difficult for families to take that step. If a family is struggling with a child who needs counseling, needs any of the services that we've just talked about, all of the resources that we just discussed are available on our website. And our outpatient clinic is available at 716-859-5460. And family can call and get an appointment for their child to be seen there or assessed or offered a referral elsewhere if it works better for the family to not have to come downtown. So there are lots of resources that we can help pair families with if they reach out.
Well, Doc, thanks for sharing some of the insight and some of the information and resources that are available from the hospital. Obviously, this is a topic that continually changes, continually evolves. So we hope that you'll come back at some point to talk a little bit more about some of the other programming that the hospital's involved with.
Absolutely. Thank you so much.